Oh, live already. Sorry, I'll just touch on my hair. Sorry. Hi, folks. A very good afternoon to one and all, and welcome to our second edition of the hybrid version of Pets Day Out. Now, this is, of course, proudly brought to you by none other than our very, very dear NParks, but it's under AVS because they're a cluster under NParks, as I've mentioned many, many times. Now, we're live here today at Jurong Lake Gardens, so for all the West Siders out there, please, if you have a pet with you, bring them down because we have got pet care, we've got health checkup for your pets, we also have adoption drive, and not forgetting also on today's platform we'll be having two fantastic vets who will be telling us more about some sensitive topics and also some microbial, I don't know that word. I need to read it through later because I kind of failed English and my English teacher deserted me when I was in school. But anyway, here today I got to tell you more about who we have in store here at Jurong Lake Gardens from 3 p.m. now all the way to 6 p.m. Now, if you're intending to make your way down here, kindly please do remember, if you're fully vaccinated, perfect. Just show proof. But if you are not fully vaccinated, you may want to do an ART test, so on and so forth. And if you're coming down with your family, keep to a group of only 5 and no intermingling. Pets included. Hint, hint. Alrighty? But here today, who do we have in store? We have our AWGs such as exclusively Mongrels, Nose Arc Cares, SPCA, and Bunny Wonderland. Just like the first episode of our hybrid, also at the same location here in Jurong Lake Gardens, we'll be taking a little tour of our event site later after we've spoken to our vets and we've answered all your questions. So likewise today, when our vets are presenting and talking about the topics, we want you guys to just fire away with whatever questions you have in mind about your pets based on the topics that are covered. Don't want doctor telling you about antimicrobial, you go and ask about coronavirus. It's a totally different ball game altogether. Alrighty, folks? So remember, keep those comments coming in, keep questions rolling in. It's all about your pets today. As I've mentioned all this while, pets' life matter. Let's take a knee. Cannot. Knee injury. So, what is going to happen here today, folks? Just remember, you have been following our PDO. For those of you who are loyal fans of ours, keep on following, but don't forget to tell your friends who are not on board yet to tune into the program from now all the way to about 4:30. But locally here speaking in Jurong Lake Gardens, we'll be having the event on hybrid level till 6 p.m. So come on down all the way to the west side. Alrighty? Now, today we've got two very fantastic vets who are going to be joining us. One is a very special vet. I got to tell you, when I first saw her, I was mesmerized because first thing, she sounds like a local TV channel, Dr. Suria, and then the surname sounded like some paparazzi, man. Fabbri. Now she's going to be talking to you about how to give the best palliative care and also near ending life of your pet, because that's kind of a sensitive topic. So I hope you guys understand that there'll be no laughter, no jokes, no nothing. We'll try to keep it as somber as possible, and we'll be joined later after that by Dr. Heng on antimicrobial resistance on animals. Okay, so now if you're ready, guys, remember, just come on down to Jurong Lake Gardens. We're here all the way to 6 p.m. We have got health checkup, free health checkup for your pets. I must stress, free health checkup, yeah, because behind the camera now I'm looking at this camera and behind that I'm going free. Yes, Singaporeans love everything that is free. Then how come coronavirus free? You're the one. Just joking, relax. This is the best time for me to crack a joke because coming up, when we cover this topic, I cannot joke too much because I've actually endured this kind of pain, suffering, hurt. I was actually in depression for almost 2 months because of the death of my pet, which is a dog. All right. So I'm just going to tell you guys a bit more about this one here. They've been telling me that we have a lot of on-site AWGs who are here and we need to just kind of touch and go with you all, okay? SPCA, we've got dogs or cats from SPCA here today up for adoption. Bunny Wonderland, bunnies, rabbits, of course. Duh. Who wrote this script? Seriously? Barney, they are here to let you adopt rabbits. No, Barney, adopt the dinosaur. Hey, my name is Barney. I'm here for adoption. Really, guys? Next up, also exclusively Mongrels. They've got a very special cute dog. Okay, Singapore special. Plus, of course, Noah's Ark Cares. Why are you giving me this kind of tongue twister on a Saturday afternoon, man? So more about these guys later. So we'll bring you to the activity ground and let you check it out. But if you are around this area, please join us, okay? Without further ado, it's already 5 minutes of introduction. I feel like a broken record, scratch CD. Let's move on very quickly to our first guest speaker today. Now, ladies and gentlemen, the topic covered is preparing for goodbye, how to provide your pet with the best care in their final days. So please join me in welcoming the very, very gorgeous and model like Miran Runway. I gotta tell you, man, if she's not a vet, she can make it in the fashion world. Let's give it up for Dr. Suria Fabbri. Hi, Dr. Suria. Good afternoon.
Hi, wow. Thank you. You really do know how to give an introduction.
My job.
I'm very flattered. So actually the topic I'll be speaking to you guys today is on palliative care for animals. So this is something that every pet owner will be dealing with at some stage in their life. And I've chosen this topic because I think it is very important for all pet owners to be aware of their choices and their options as their pet proceeds to start aging, just so that you can be aware of, oh right, sorry, looking at the camera. Just so that you can be aware of what to really look out for and providing the best quality of life for your pet. So just to start you off, a little bit about why palliative care is so important and what exactly palliative care is, palliative care and hospice is. So it's essentially a care program that takes care of your pet's physical, emotional, and social needs once they have been given a diagnosis of a life-limiting disease. And it also focuses on ensuring that the owner's emotional, social, and spiritual needs are being met in the process of providing this end-of-life care. So it really focuses on maximizing comfort for your animal and minimizing suffering throughout this entire period. Yeah.
So I'm going to ask you, Dr. Suria, if you don't mind just calling you Dr. Suria.
No, that's
so
fine.
Dr. Fabbri, sounds very
formal.
Yeah, very formal, and then
formal.
it sounds like some kind of detergent for laundry and all this stuff. So, okay, jokes aside, but let's get down to the serious part of this. For me, I actually had a pet years ago when I was still young and had a bit of hair, and I didn't realize that there was this palliative care, and I thought all the time that palliative care was more for humans, like they've got hospices and all this stuff, or
Sure.
for cancer patients in their final months and all that stuff. So how was this just a recent thing, or has this been ongoing for years?
So that's a really good question. So palliative care, it is something that, we really relate to the human experience of providing care before your final days. And with the role of animals in our lifetime changing from before, when people used dogs, it was more for like pest prevention around the house or farming, but now they're companion animals, and pet owners really are going down the avenue of ensuring that their pets get the best care, especially in their later years, sort of as a thank you before their pet passes on. So yeah, essentially that's something that that pets and pet owners need to start thinking about quite early. So we'll start off essentially by giving you an indication of what, as a pet owner, you need to be aware of when making the different types of palliative care and hospice care decisions for your animals. So the first thing that you really need to do is sit down with your veterinarian and have that discussion. Sit down when your veterinarian tells you the news of potentially, and it could be any sort of debilitating disease that does result in end of life. You really need to take the time to schedule a consultation, an extended consultation, to talk through all your options. The first part of it I would really recommend is understanding exactly what it is your pet is suffering from. You need to talk to your veterinarian about the disease itself, what it does to your animal, the course, the prognosis, and how long you expect your pet to live, and also various other factors. So your veterinarian will be able to advise you on the rate of deterioration, at which point you need to check in on your animal. And it's also really important that you have a good idea of the options that are available. So the different treatment options that you can get essentially for animals, it varies from a treatment which aims at improving comfort for your animal during this period of time to a potentially curative treatment. But one of the things that veterinarians and pet owners both face is the question of, just because you can do something, is it something that you should do? So let me just backpedal a bit and explain this. So if, say, for example, you have a senior animal, and your senior animal happens to be suffering from cancer, and it's very common in veterinary practice that they would recommend that in order to get the final prognosis, a biopsy is required. What I would recommend in this case then is to have that discussion with your veterinarian to understand what the biopsy is, what it involves. So while you do get the end prognosis of understanding what your animal is suffering from, you do have to be aware of what you're actually putting your animal through. So if it is a gastrointestinal biopsy, that is an open abdominal surgery, and that can cause discomfort for your animal. So this is really something that I would urge you to speak through with your veterinarian. Another really important aspect of coming up with this end-of-life care plan is understanding the financial burden and the emotional burden. So I'm sure many of you are familiar that, when you have that young, healthy animal, your visits to the vet are often infrequent, but you need to be prepared that as they start to age, your visits to the vet will increase. And it's the same for humans. As you get older, you do need to go to the doctor more frequently. So in the process of coming up with this care plan, you need to be aware of what the potential costs would be like all the way to the very end. And even in that, the amount of resources that you have to expend financially and emotionally, because I think that we're all very aware, myself as well, having lost my pet in the past, it does take a lot out of you. You really have to take the hours to take care of your pet, and it should be discussed within your family who is going to be the primary carer. So when you have identified the primary carer, the other responsibilities throughout the family should be distributed, and it really needs to be open communication between you and your family, and of course your veterinarian, in making sure that your veterinarian understands really what you want. And when I say that, it means that you need to be quite open with things like your emotional and your spiritual or religious requirements for your pet. If you have certain beliefs that you would like to be respected, veterinarians are very open, they're very understanding, and the more information that you give them, the more they can work with what you have. And this all comes down also to the very end, so that ultimate decision of whether or not you want to choose the route of euthanasia, for example, or hospice-assisted natural death. And in hospice and palliative care, both of them are completely reasonable options, and pet owners ultimately will need to decide on which option suits them and their beliefs better, assisted with their veterinarian. So it's just very important for me to say right now that something like natural death is not supported in the absence of pain relief and making sure that there is some sort of intervention to make them comfortable in their dying days. So it doesn't necessarily mean that no, we don't allow for natural death. It just means that veterinarians really are looking out for the care and comfort of your animal. So if that's the avenue that you want to go down, then you need to make the provisions to cater for the most comfortable passing of your animal. Yeah.
Okay, before we carry on, Dr. Suria, I'm just going to be very honest. Amongst all the episodes so far of Pets Day Out, whether it's E-Pets Day Out, Hybrid Pets Day Out, you're the only one that I could just sit here and just listen and not even bother about asking questions and all this stuff, because you just went on very, very smoothly, and it was like, just second nature to you. But I think having sat here for the past 5 minutes listening to you, I'm not trying to be funny here. I'm not trying to be politically wrong or whatever with this statement. But pardon me for asking a really stupid question. Palliative care for animals, for pets, compared to humans, is it pretty much the same?
It is. So
there is an institution that looks after your pet.
Well, so maybe in that way it differs. So in various countries, so in the US, for example, and in Australia, there are veterinary care services that specialize in palliative care and hospice. So you would get together with a team, they would talk you through the process, and they would help you set up your house, or if you choose that you want your animal to live out the remainder of its life at home, they would be able to advise you very closely. There are other services offered internationally, but unfortunately here, it's something that you deal with your direct veterinarian. So I personally am not aware of any individual veterinary center that specializes in this, and it doesn't mean it doesn't exist, but I'm just not aware of it. But all veterinarians are skilled and trained to be able to talk about hospice and palliative care. It's just a matter of taking the time out to sit down and really discuss your options. Yeah.
So in that sense of the word speaking, that is why I asked this question, because I do not want this to be a platform whereby people hear about this and they find it that, hey, there's an option. I I could just leave my pet there and it's all right, when pass on, I'll just go there, take a couple of photos for Instagram kind of thing. So which is why it draws on me that in my pet's final few months, you could tell that this guy was just moving on, no appetite, just passing motion and urinating all over the place. And you start to go like, hey, this pet has been with me for almost like 16 years, 17 years, and you just want to spend that last few months. But because of work and the nature of our society and what we need to do to just provide for our own family, it becomes a bit of a very taxing situation. So if someone or a pet owner is unable to provide such care for their pet in their dying years or in their final years, what would your recommendation be?
So, firstly, thank you for sharing that, because I think that that's a struggle that a lot of pet owners deal with. And I actually do want to dissect your question a little bit, because while it comes across as one question, there are various parts about it. So the first part that I want to address is, what does a good end-of-life care plan mean, or what does it look like to pet owners? When you understand the basic concepts of an end-of-life care plan, then you can assess whether or not you actually have the time and capacity to take it on, whether or not it's something that you want to do personally, or whether or not you want to work with your clinic to help provide that service. So let's start off with the three basic requirements that need to be fulfilled for this. The first one being your pet's physical needs, the next one being your pet's social needs, and finally the third one being your pet's emotional needs. And I know it sounds, especially bringing emotion into it, it's not a word that you often hear your veterinarian use a lot around animals, but I'll explain it a little bit later, and it will make a little bit more sense. So starting first with your pet's physical needs. During this hospice care procedure, this hospice care program that you'll be devising with your veterinarian, when meeting the physical needs, the main focus really is to maximize comfort and relieve suffering, okay? So when I say relieve suffering, it doesn't necessarily just attribute to the physical suffering, so the pain, but also mental suffering that we all know. Everybody's pet has a personality. You know that they have the capacity to have feelings and different reactions. Your pet has favorite things. So emotional suffering or social suffering are things like lack of socialization, or being ostracized or being bullied by other pets, things like that. So starting from the top again, meeting their physical needs. So we are alleviating pain by means of different ways. The first one obviously being medication or pharmaceutical alleviation of pain. And that's when your veterinarian will go ahead and prescribe painkillers for two different types of pain. So one could be for the acute pain, and that tends to be the pain that a lot of pet owners are aware of, the yelping or the groaning. And the thing that you do need to realize about animals and pain is that by nature, animals actually mask their pain. So when they do show these outward signs of pain, it means that they can no longer mask their pain, and it has become very acute. The other type of pain that animals can experience is something called chronic pain, and it's what develops as they are going down that deteriorating path. If we make a comparison to humans, for example, when humans are being diagnosed with a terminal disease, they always say, they say there are studies that suggest that 30% of humans experience some form of pain at time of diagnosis, and this leads up to 70% when they are on their deathbeds. So in hospice and palliative care, we really relate that quite closely to what we anticipate the animal is experiencing, which is why we try to cover for pain even before we can see it. The other thing about chronic pain in animals is that it tends to be very subtle. As I said, animals always mask their pain. So it can appear that perhaps your animal has a slight limp, or even more subtle things like their inability or unwanting to walk up the stairs. There may be a slight decrease in their appetite. And these are all indicators of potential chronic pain that if you do pick up on as a pet owner, you should have that open discussion with your veterinarian and tell them, I don't know if the medication that we're on is really covering for all of this. The next point that we'll be talking about is also making sure that you manage their other symptoms. So depending on what type of condition your animal is suffering from, if it's gastrointestinal, maybe they're nauseous, maybe they are suffering from diarrhea, there's other medication that you can give to make them a little bit more comfortable. Obviously, monitoring food and water intake is really, really important in this process, and that's just to make sure that they get adequate nutrition and hydration. But one of the things that you have to be aware of, because it is palliative care, is that at some stage, as Justin had said, slowly the amount of food that they intake and the amount of water that they intake reduces, and that is part of the natural dying process. Another thing to consider, especially when you do decide that you want to set up for hospice care at home, is setting up your environment. So that means allowing for mobility, making sure that, say for example, you have a big dog and your dog is having difficulty moving around and the floors are slippery. You could perhaps put in some rubber mats to make it easier for them to gain traction on the floor. You can also assist them with mobility with slings, or if you have cats, for example, you can put the litter box in a more accessible place, just so you can really maximize comfort around the house. The other thing that is really important when you have your pet at home that you are looking out for is to make sure that the remainder of their environment is optimal. And I say that paying attention to the subtle things. So the temperature, is the room too cold? Is there places where they can seek warmth? Is it humid? Is there good airflow in the house? All these types of things, and even lighting or irritating noises. All of these things can really change the experience for your animal and make them feel much more comfortable if they are, say for example, experiencing discomfort, right? So then moving on to the next part, now that I've covered the physical needs, is I guess less often discussed is the social needs. So this is something, as Justin has said, we're all very busy. We may not have the time to sit at home with our pet as they're going through this process, but it is really integral. It's one of the three core features that you need to think about when you are discussing that with your veterinarian. So the social needs of your pet, for example, are, if your pet is a companion and it's used to being around family members, is that something that's going to change? Is there still family around that can spend time with it and play with your pet? That's really important. Are there other pets around? If there are other pets around, then you need to make sure that their time together is supervised, just so that if there is a hierarchy in the house, that's not disturbed, and ultimately your sick pet remains safe. And then mental stimulation. So, is there a window outside that they can look at? Are they just isolated in this small corner versus, can they move about the house? These are all factors that I would really, really urge pet owners to think about when they are deciding about what their best end of life care plan would be. And then finally, you have the emotional needs of your animal. So what do emotional needs of an animal look like? This is a question that I get asked, and it's mainly three principles that you need to think about. The first one is stress. So if you are taking care of your animal at home, you need to think about the routine. Routine is something that animals like listening to, they get used to, and then ultimately, if you change up the routine, you can be introducing unnecessary stress. Another thing that I would encourage pet owners to look into, especially when you're looking at the emotional needs of your pet, is something like their will to live, okay? We know that pets, as they go towards their dying days, they can undergo things like depression, they can go into hiding behavior, they don't want to be pet, they don't want to be fed. These are all things that, with my client personally, I tell them the best way to do is to keep a journal. If you keep a daily journal of what your pet is experiencing or what your family members have noticed about your pet, you can track the progress over time, and you can make intervention decisions along the way with your veterinarian if you pick something up. So to get back to your question, Justin, on what pet owners should do if they feel like they can't meet these needs, then they need to have that realistic conversation with their veterinarian and say, do we actually have care or family member at home that can provide this care? Am I meeting all three of those? So physical, emotional, and social needs. And if they're not, then their veterinarian will be able to advise them things that they can change around their house, modify in their environment by means of video or photograph, just to maximize it and decide when to draw the line and say, okay, you know, at this stage, maybe we want to make a decision for euthanasia or otherwise. Yeah.
That was where I was gonna go to about this word euthanasia. So to certain pet owners, I guess they won't pick this option because it's like, I'm killing my pet. I'm literally killing my pet. But if the situation calls for such a decision to be made, I think sometimes it would be the best decision for both the pet and the owner. I think if I say that, I'm not really wrong, or I'm not encouraging you guys to do it, but sometimes you just have to outweigh your resources and also whether you have the ability. Like for myself, just to share, when my pet was in his final few months, due to the nature of my job, I was practically not home every day, especially weekends, Fridays and Saturdays. So I made it a point, like, you know, Sundays I have to have my time with my pet, just to carry this fella all the way down. Can't walk, doesn't matter, put on doggy diapers and all that stuff, and then just let this guy do what he used to do with a lot of aid. So I think it's pretty much like how you would handle a human being, whether it's your granny, your granddad, your parents who are aged. It all boils down to pets are also lives. Humans are also lives. If we want to be treated correctly, what makes you think your pet doesn't want to be treated correctly? Because I'll be honest, is what Dr. Suria mentioned, in the final 2 to 3 months of my pet's life, he passed away just a day after my birthday, and I made this statement like, you want to die, you don't die today on my birthday. Eat this durian cake that you like so much. Tomorrow you want to go, you go, it's okay, eh? And true enough, this chap actually passed on the day after my birthday. So to a certain level, I think the final few months he was being very nasty. That's what you mentioned. A lot of gnarling, you know, a lot of growling. The minute I put my hand on, starts to bite, which never happened. And I used to hit his snout just to play with him. And this time on, as long as you got near to the snout, this guy went berserk, went ballistic, like anybody, even my granny, my mom, my dad, my helper. So I think it's pretty much also like human behavioral sciences. If I know I want to go, I don't want someone who loves me dearly to be so emotionally attached. So don't take what Dr. Suria has said as just as a typical vet who's gone through a 10-year series, maybe study in Oxford, in Australia, come back, graduate. Now they go by book. It's not book, because if you are a pet owner and you have a pet who has already passed on, you would understand and know what Dr. Suria has said is all true. And by doing so, maybe you're just trying to push away someone so that when you depart, or when this animal departs, your pet moves on to the next level of his or her life. It's basically just trying to tell you, like, you know, it's okay, just let me go, you know, this is why I want you to hate me and not feel so much pain. You've covered a lot about emotional for the pets. Do you guys, or do you vets, have any sort of support or advice in terms of emotional? Even now, it's been years, okay, Dr. Suria, it's been years, but as I say this now today, I'm still starting to feel a bit emotional. I guess the bond between a human and a pet is something that is truly remarkable, because they say dog is a man's best friend, cat can also be a man's best friend, as long as it's a pet that you hold dear and you treasure this animal that much. I think to a certain extent you will feel affected. So you mentioned about emotional, then is there anything for humans?
Absolutely, and you know, it is a very individual experience. You know, even what you're describing to me and what you have gone through with your pet, that's a very unique, it's a very special bond, and every pet owner has that with their own animal. So the different emotions that pet owners experience through this process can vary. So you can have feelings of grief, feelings of guilt, feelings of sadness, all the way to the other side of the spectrum. So feelings of relief that their pet is no more suffering, feelings of you know, they feel like, pet owners perhaps feel like they've done their role in providing the best end of life care. So it's just very important to know that things or the different types of feelings that you experience in this whole end-of-life care and grief process, there is no stock standard template. It's very important that you surround yourself at this point in time with family, with neighbors, with friends, and it's very, very common that if you feel like it is getting completely overbearing, which fairly so, then you should seek help with a mental health professional. And this subject, I think, can sometimes come across as quite taboo. You know, people are very afraid to step out and get help. And I think that that's really not necessary, because at the end of the day, all these people are here to help you, okay? And they're here to help you through your process. Currently, when it comes to mental health professionals specializing in the loss of animals or end-of-life caregiving for the human owners, there aren't any standards for that. But there are mental health professionals that specialize in grief and trauma and family, and all of them would be very helpful, especially if you do need to explain to the kids, you know, what's happened to your pet. Essentially the message that I'm trying to say is that whatever that you're going through, it's completely normal. And I say that in the way that there are different avenues that you can look to. Say, for example, you're somebody who doesn't feel comfortable speaking to your neighbor or your family member. You know, if you're the breadwinner and you're always that strong person in your family, maybe you don't want to speak to anybody you know at all. And in that case, I would recommend that you reach out to maybe online forums. You know, there are lots of different types of forums that can be shared at like pet crematorium services. They have support groups that you can tap into, and all of these are really, really good ways in which you can speak to people who are undergoing a very similar situation as you. I've even seen there are certain websites that offer candlelight vigils to commemorate the loss of a pet. And during my time as a vet in practice, I would see pet owners come and to, in memory of their pet, they would make donations to animal welfare groups. They would plant a tree in memory of their pet at whichever park or whichever street that they would always walk down. So these are good ways that I would urge pet owners to sort of look into, you know, making good memories of the lovely and sort of like fulfilling life that they've given to their pet as well. Yeah.
Totally agree with you, heart and soul, head and toe, man. It's like the ashes of my dog is still in my house after 20 years. It's still there, and it's on the altar. That's the best part. And then yet, grandparents are in a niche somewhere in a church. It's sometimes life can be that crazy, you know. Like, my pet more important to me. What kind of a human am I? Anyway, I'm not going to be the one asking questions now, but I will be asking on behalf of some of our viewers out there who have actually posted questions on our platform. So, guys, you may want to help me out if I can take the first question from Erika Pei. I can't seem to let my pet go even though she's suffering, and I hate to admit that she's in her last few days. What should I do?
Okay, Erica, I think that what you're experiencing is very common. There are plenty of people dealing with a very similar dilemma that you're dealing with at the moment. So, I mean, my advice, and I am not a clinical psychologist, I am not a mental health professional, and I cannot tell you what exactly you should do. So I feel what you should do, though, is take a moment to really understand what your struggle is with letting go. I understand that for a lot of animal-human bonds, they're so tight, it's so close-knit, that you just can't bear to see the passing of your animal. But you always have to be aware that from the very start, the life expectancy of pets is very different to humans. So in a way, it's almost inevitable, right? So if you are having issues with accepting the loss, or you're having issues with being able to let go, I would really recommend that you reach out to these support groups, or you reach out to other people who have been in a similar scenario, and even have a chat with your veterinarian. You know, your vet will be able to tell you what exactly is it that you're worried about when it does come to letting your pet go. So, yeah. Thanks.
And I think I'll also add on to this, Dr. Suria, about this question from Erika. It's, I think, Erika, speaking from a pet owner's point of view, I'll be very upfront and tell you this. It's about that mindset, because to me, when my pet passed away, even my parents thought I was crazy, man. Like, hello, I think if I die, you also don't behave like that, man. I also don't think it'd be so sad, man. But but this is the relationship I have with my pet, and this is, I know my parents kind of love my dog because they are, special days, we'll get this dog to walk around and pick up cookies with numbers on it. I mean, I'm not advocating anything here, but I think most of you understand what I'm trying to say. So after picking these numbers on Wednesday, Saturday, Sunday, they will try their luck, and then sometimes they strike, and then this dog is being loved. But to me, this pet was a friend because I'm the only child. So my advice is this, Erika, if you think you are unable to let it go, I hate to break it down to you, you have to accept it. It's all about the acceptance. And after acceptance, it's about how you want to move on. Surround yourself with friends who believe in you, who understand you, who understand the importance of what your pet was to you when it was alive. And now that it's gone, how much it's affecting you. Because friends who are judgmental and go, crazy man, well, no children, let the pet like their children. What kind of nonsense is this? They don't understand. So if people don't understand, just let it be. Move on. Like Dr. Suria has mentioned, there are a lot of help groups out there. Reach out. Never be afraid to address this issue. Never be afraid to admit your pet meant the world to you. That is what is important. Alrighty? So next question. I hope that answers your question, Erika. Jessica Ong. My 12-year-old dog is starting to reject food and water. She also tends to have a bad smell at the time, all the time, and is this a sign of her passing on?
Okay, so thank you for your question. It's great that you've made these observations in noticing the different changes in your pet's eating habits, drinking habits, and also obviously the environment, the smell. I guess the first thing that I'd ask you to consider is, have you actually seen a veterinarian? So it's very different. A 12-year-old large dog is incredibly geriatric, so very, very old, whereas the 12-year-old young dog, they can generally live much longer. So for me, before I can even begin to understand what you're referring to, I need to know whether or not you've actually seen a vet about this, or whether or not your pet is even in that palliative care phase of its life. So yeah. What I would recommend at this stage is have a chat with your veterinarian, understand why this is happening, if there's something that you can do at home to correct it, if there's a different type of care or comfort that you can provide, then that would be the different areas that you should explore. Yeah.
Alrighty, I'm getting a little cue here that we need to move on to our next vet because I think he's already starting to write a journal while waiting for us to hand the time over to him. But Dr. Suria, before we even say thank you to you, are there any parting words to our viewers out there with regards to this topic that you just covered about, how to approach end of life, and post-end of life?
Okay. So I guess essentially the message, the bottom line of what I'm trying to share with you today is to be aware that when you do get to that point, and every pet will get to that point, is that you have choices, okay? Don't ever feel like you don't have choice, that you're being backed into the corner. You should only do things if you feel comfortable with it. Veterinary team will rally around you. They will help you feel comfortable. If you don't feel comfortable with your vet team, you need to make it apparent and make it known so that they can provide care to you and your animal, because providing care to you is really important as well. And never, ever, ever feel that you're alone and that you can't seek help, because this is something that everybody goes through. Every pet owner has thought, I feel completely alone in this. I would say that you are not, 100% not alone. I've been there too. Yeah. Thank you. Go ahead.
No worries, Dr. Suria. Really, thank you for those very insightful sharings and letting our viewers understand about palliative care for pets and how they should handle the end of life process of the pet, from pre to the passing process and also the post. And as they would say in all true Italiano style, Dr. Suria, grazie mille, eh? Not bad. I can part Italiano, pizza. Okay, never mind. This is nonsense. Enough, like you. Wow, that topic, like a bit. Wow, cannot, man. Emotive. I felt so like like sour like that, like sing swan, like assam like that. But coming up next, ladies and gentlemen, before I hand it over to a very lucky doctor, Dr. Heng. Get it? Okay, never mind. Lame joke on a Saturday, it's alright. But anyway, before I hand it over to Dr. Heng, here's a public service announcement. I like this. They make me sound like some kind of like, This is a public service announcement. All right, folks, listen up. In recent times, there have been a lot of reports and also incidences that some of our people from NParks, or our staff from NParks, and also some of our viewers have noticed is that all our pet owners here in Singapore are starting to behave a bit not so responsibly. You know, when you bring your dog, your pet out for a walk or whatever. I'm not specifically saying it's only dog owners, please. I'm just putting it generally speaking. Some of you don't walk cats, yeah, I understand, but you let your cats walk around also. So if you have pets, they are in the neighborhood, you've got neighbors around, please just be a bit more mindful about the neighbors and try to handle your pets correctly and responsibly. Please be a social pet and not a social pest. There is a total huge world of difference, alrighty? If your dog poos somewhere in public, use the plastic bag, just over your hand, pick it up, turn it the other way around and dispose of it correctly, not just any old how. Now, if you have cats with you in your house, try to fence up your house so that your cat doesn't actually go to your neighbor's house, start to go inside this and that. Just keep an eye out. And if you have other pets, I don't know, Kodomo dragon, whatever, just be more civic minded. That's all we're asking you guys to be as pet owners here in Singapore. Alrighty, so help us out and let's make this a more conducive environment for both pets and humans alike. But coming up next, ladies and gentlemen, oh my goodness, he's a veterinary graduate from the University of Melbourne, Australia. He has worked in a variety of practices between Singapore and Australia. Why do you all write this? Because these are guys who are legit. They are legit. They are from AVS. You need to give me his whole biography. Like, he's married 6 times, divorced 7 times. He's still good looking at this age. What? No need. He's legit. But what topic he's going to talk about? I swear to you, this sounds like some Transformer movie, man. Let me try to do this. Coming up next, Autobots. It is time to talk about antimicrobial resistance, the rise of the superbugs. Let's welcome Dr. Heng Zhan. Move out, Autobots.
Okay, thanks Justin for the great introduction, and thanks Suria for that very informative talk that we just had. So good afternoon everyone. My name is Zhan. I'm one of the vets from AVS, and today I'll be here to talk to you about the topic of antimicrobial resistance, also known as AMR in short. So let's start by looking at what antimicrobials are. So antimicrobials, by definition, are basically medicines you use to treat and prevent infections in humans, animals, and plants. So the well-known category of antimicrobials would include things like antibiotics, which we all know quite well. But there are also other categories like antivirals, such as the Tamiflu that we use for flu in humans, ivermectin, which has been in the news for all the wrong reasons lately. So 18th to 24th November, which was about 2 weeks ago, was designated by the World Health Organization as the World Antimicrobial Awareness Week, or WAAW in short. So WAAW is actually is held yearly to help raise awareness about AMR and to stop the spread of antimicrobial resistance. Hence, that's the reason why I'm here today to talk about this topic. Alright, so next let's talk about what exactly AMR is. So AMR is essentially the process of evolution when microorganisms, they are exposed to selection pressure of the antimicrobials, they mutate to become resistant to the antimicrobials. So I actually want to emphasize that this is actually a naturally occurring process that occurs out in nature. The issue is what we humans do that actually accelerate this process. Okay, so next, let us examine what actually drives AMR. So I've quoted this study here, which they looked at the different causes of what drives AMR, and from what we can see here, globally, the main causes that accelerates AMR is the misuse and overuse of antimicrobials in the human and animal sectors. Alright, so now let's have a little bit of a look at some of the examples of what misuse and overuse means. So for the first one will be using antibiotics unnecessarily. So some examples could include if the infection is viral or when there's actually no actual infection. So I've got two pictures on the right there. So the first picture on the top right is a chest X-ray of a dog in heart failure. So dogs in heart failure, they oftentimes cough. But what else can make a dog cough? If they have an infection. So when the dogs cough, that's why it's important to bring your dog to a vet so that they can figure out, is it coughing from a heart failure or is it coughing from an infection? Because if you're using antibiotics when they actually have heart failure, then it's not going to work, and also it's going to be dangerous because you're not giving your dog the right treatment. The other picture I have on the bottom right is that of a cat that's straining to pee. So it's quite a common problem we see in cats where they have urinary issues. Sometimes it could be caused by an infection, but in certain cases it's actually not an infection related. It's not actually a real infection. So in these cases, if they're given antibiotics when there's no infection, then that's an example of misuse of antibiotics. So other examples would be not self-medicating. So if you have antibiotics at home for some reason and you're just giving it without actually seeing the doctor for advice. The third one would be if you're not following the instructions on the prescription when the doctor has prescribed the medications to you. And the last one is more based on what the clinician does. So if the wrong antimicrobial dose, the duration or the type is actually prescribed. Alright, so now that we understand how our actions can drive AMR, let us examine the consequences of AMR. So antimicrobial resistance is actually now present in every country in the world, and sometimes the media terms it as superbugs. So we can see the mention of AMR in the human sector quite extensively in the local media, as you can see from these news headlines that I've pulled out from the internet. So the reality is that animals are not spared from its effects either. Alright, let us now examine the impact of superbug infections in more detail, especially in the animal sector. So infections that are resistant to multiple drugs are basically, to put it simply, they're more difficult to treat. And what that means is that, the treatment may be longer, more expensive and more complicated. And if we cannot treat these infections, that can also have impact on animal health. And lastly, there's always the potential of certain infections, being passed on to the pet owners as well. Alright, so let's take a quick look at some of the possible, superbug infections that we sometimes see in our companion animals. So in Singapore, probably the most common infections we tend to see will be your skin infections and your ear infections, which I've included the top two pictures here. The thing is, by looking at these pictures alone, you cannot tell if it's a superbug infection. So what actually needs to happen here is that we usually need to do further testing to determine if the infection is caused by a superbug. And another important point that I often highlight for skin and ear infections is that the infection is often secondary. So what that means is that there is an underlying problem that is predisposing the skin or the ear to getting infected by bacteria. So the main underlying cause I'm actually referring to here is skin allergies. Alright, so for urinary tract and respiratory infections, the reason why I put some question marks there is because, as I've previously mentioned a few slides ago, that sometimes some of these urinary and respiratory diseases, they actually have the same sign as an infection. So it's always important, that's why, to have a vet examine your pet if you're worried that such infections are happening. And in some cases, they may order further tests to actually determine whether the cause is actually truly an infectious cause. Alright, so next let us move on to see how we can tackle the problem of AMR. To tackle the problem, we need to understand the underlying pathways leading to AMR. So this is a very complicated slide. The reason why I'm sharing this slide is to highlight that actually AMR is a very complex problem involving various interplay of sectors. As you can see from what I've circled, basically that's the companion animal sector, but there are other sectors like the food animals, the environment, and the human medical sector as well. So, given the complexity of AMR, so what we actually need to do is adopt a One Health approach. So let me elaborate a bit more about what One Health actually means. So the One Health concept recognizes that there's a close interrelationship between the health of animals, humans, and the environment. So a One Health approach is reference to a multi-sectorial and multidisciplinary approach with close collaboration between various agencies and stakeholders to tackle a problem that is as complex as AMR. Alright, so using this One Health approach, basically we had representatives from the Ministry of Health, then AVA, which then became AVS, NEA and PUB. We coordinated the efforts across the animal, human, food and environmental sectors in order to develop a national strategic action plan on AMR. So this action plan actually sets the framework for a national, coordinated response to AMR. As part of this, the Antimicrobial Resistance Coordinating Office, AMRCO, was established in 2018 within the National Center for Infectious Diseases, the NCID, to oversee the implementation, monitoring and evaluation of this National Strategic Action Plan. So we've talked a bit about the entire government's plan to fight AMR. So now we talk about what is MPAC's role in all of this. So first and foremost, MPAC, we raise the awareness of AMR issues in the animal sector. Hence, that's why we're having this talk today. In addition, AVS is also conducting AMR surveillance in animal populations in Singapore, which not only includes pet animals but farm animals, strays, and also wildlife. So the idea is that with better understanding of the prevalence of this problem, the risk of the AMR spread between animals and humans, then we can policies, regulations, and outreach efforts then can be better developed to suit our local context. So the other important aspect is that vets are important stewards of these antimicrobial medications because we're the ones who actually dispense them. So they are the advocates of animal health and welfare, and they provide veterinary medical services to treat and prevent diseases in animals. As such, AVS has worked with the Singapore Vet Association to publish national vaccination guidelines for dogs and cats, and with the aim of improving preventative healthcare and to contribute to the efforts in tackling AMR. So, additionally, this year we actually are rolling out a new guideline on the prudent use of antimicrobials in companion animals, which I will talk about more in the next slide. I just want to highlight these publications are actually freely available on the internet for you to download and read if anyone's interested. Okay, so let's talk a bit more about these guidelines. So these guidelines for the prudent use of antimicrobials in companion animals, it was developed in consultation with private vets and also specialists. So it covers the commonly owned pet species in Singapore, such as your dogs and cats, birds, even fish and also small mammals. So what it does is that it provides a updated practical recommendations on how to use antimicrobials prudently, together with some relevant resources on AMR and antimicrobial stewardship. As veterinary medicine is a constantly evolving field, the guidelines will also be updated regularly, to reflect new developments and new knowledge. So some of the recommendations included below are included below. So, for example, diagnostic testing is vital to practicing good medicine. So it helps to guide our diagnosis and making clinical decision making. So in layman terms, what that means is that it helps us determine if it's truly an infection or could it be, and what type of infection it is and what type of antimicrobials are most suitable. As previously mentioned a few slides ago, it's important to get your dose, your duration, and type of antimicrobial correct when vets are prescribing it. So these guidelines help to provide some sort of recommendations, to vets on what they should be using in various clinical situations. We also briefly mentioned that there are certain underlying diseases that can predispose animals to infections such as the ear and skin infections that I talked about. So this is important from an AMR's perspective in that by treating the underlying diseases, sometimes we can actually reduce the chances of the infection from happening in the first place. Therefore avoiding the need for antimicrobials to begin with. All right. So Next, let's talk about what pet owners can do to help play that role in this fight against AMR. So the fight against AMR is a coordinated effort by all parties. While in the previous slide we talked about how medical professionals such as vets play a key role. As pet owners, which I'm also a pet owner, we can also help to play a part in tackling this global health threat and safeguard the use of antibiotics for future generations of humans and animals. So here are some of the practical things that pet owners can do. So, only use antibiotics when prescribed by a vet, because, not every illness requires antibiotic treatment. Following the dose, the frequency, and the length of antibiotic treatment as prescribed by your vet, complete the entire, course of treatment, even if your pet seems to have recovered. So if you do have any kind of, concerns about, how to give the medications to your pet, or you're concerned about the side effects, discuss it with your vet, and then see what other alternatives or what other ways you can get around this problem. Avoid sharing leftover medications, or using leftover medications. So don't self-medicate if you happen to have, medications lying around. So keep your pet, and the next point will be to keep your pet healthy with appropriate nutrition, exercise, and hygiene, because a healthy animal can fight off infections better. And lastly, adopt preventative healthcare methods as recommended by your vet, because if you can prevent things from happening, it's better than having to treat it. So one of the ways would be to keep your pet's vaccinations and your preventative flea and worming treatments up to date, as this help prevent infections. Alright, so to summarize, the problem of AMR is an unseen enemy sort of lurking in the background, but we need to act now, and this is why the various government agencies have been working together closely to tackle this problem. And more importantly though, us as pet owners, in wider stakeholders in animal industry can also play a role too, and it's only when we all work together, government, the public, the industry, that we can successfully tackle this AMR threat. Alright, so this is the end of my presentation. So to end it on a more light-hearted note, so I always try to draw the analogy that AMR is kind of like a super villain, like, I don't know, Thanos or something like that, and all the One Health agencies, and the general public and the animal industry, we're all like an assembly of superheroes, like the Avengers, working together to fight this super villain or superbug, and it is only together with our strength in numbers, that we can actually defeat, the super villain or superbug, like how Avengers defeated Thanos. Alright, so I think that's the end of my presentation. We will take some questions. Alright. So, Nur Hafiza has a question on my pet reacted badly to an antibiotic prescribed by my vet. Should we immediately stop it or complete the course? So yeah, I think that's a very good question. So in this case, as I've mentioned briefly in the presentation, if you are worried about side effects, contact your vet. Contact your vet immediately and ask them for the advice. Should you continue it or should you stop it and try something different? So So chat to your vet. See what can be done in this situation and how to get around the problem. So anytime you're worried about any treatments that you're given, always best to consult with your vet. All right. So, all right, Wayne asks, where can I read more about AMR? Are there legit info sources that pet owners can access? So for this point, I believe NParks does have a section on AMR on our webpage. So if you Google, if you go and Google it, you should be able to find information on that. So there's like this. So there's various handouts on on this on our webpage. So yeah, you can go and check it out there. All right, Nicholas has one question. Is antibiotics the only effective medication for sickness in pets? So yeah, that's a good question. Thanks, Nicholas. As I mentioned, so if your pet is sick, it may be an actual infection, but it may not be. So it really depends on what symptoms your pet is showing, and And yeah, so the important thing is to bring your pet to a vet so that your vet can determine A, what's the problem and what's causing the problem. Is it an infection or is it something else, you know? Because then they can decide what sort of medication your pet needs. Is it, if it's, like I said, if it's an infection, yes, they probably will need antibiotics or antimicrobials. But if it's, you know, something else like, you know, heart disease or, you know, then yeah, you're not going to need antibiotics. Yeah, so it really depends on the situation. So, you know, the idea is to get the right diagnosis, know what's wrong with your pet, know what's the underlying issue, then the right treatment can be prescribed. All right, so I think that's it for now. So we'll hand the time back to Justin. Back to you, sir.
Thank you very much, Dr. Heng. I like this guy, man. What, you're like, what? Got superhero, Avengers, got Thanos, got this, that. This guy, I tell you, I think he's more than a vet, man. He's like a comic book writer or something like that. Must be. But anyway, I like what Dr. Heng said. So please, if you're unsure, if you're in doubt, your animal, your pet sick, please go to a vet. Don't ever attempt to buy any sort of medication that you think is right, because sometimes you do not know what is right for your pet. That's why we have vets available, and these guys are trained, they study, they know the behavior and the health of your pets. So kindly please remember, vets are the people you visit because AMR, correct? AMR. All medication reliable. AMR. Not bad, Justin. Last time my AMR in the company I work for, it's called All Money is Recovered. Anyway, talk about recovered, ladies and gentlemen. It is time for me to recover from this position, stand up, and just let you guys know, we'll be touring the event ground for our hybrid Pets Day out here at Jurong Lake Gardens. Now, just to let y'all know, for the health screening and health check, it's pre-registered. So if you're walking in thinking you can do a walk-in, nah, it's not gonna happen. Life is unfair. If life were to be fair, we would have had hair. So, in order for me to walk around, ladies and gentlemen, I need to be a very socially responsible adult Singaporean. I need to put on my mask, and then the best part, I forgot I got my earpiece. And after that, about halfway when I take out earpiece, cannot hear, then all kena sangkut. Kau botak dengan bodoh lah, boy. Seriously, sometimes I think to myself. And as usual, I got my trusted buddy out there. Adrian, you ready? Okay lah. If you're ready, then let's walk. I'm getting underpaid for this job. Huh? What? Ready?
I tell you what, bro. I'm very nice to you. I'm very nice to you. Because normally a lot of people they don't want to care about the crew and all that stuff. But for you, bro, you know it looks good lah. This angle, the viewers are seeing like happening. But you just do me a favor. Stop, Adrian. Don't move. Switch. Turn. Very good, bro. I walk backwards, you walk forward. Easier for you because you're holding on to a very, very important thing called Apple iPhone 13. That's your phone some more. So if this phone drops, then there is a problem. Now folks, as you can see, we have a lot of people already coming in and joining us here live at Jurong Lake Gardens. But please remember this, okay? We are NParks, this is under AVS, we are a cluster under the NParks group, so please remember this. We need to be socially responsible. You see everybody out there, long queue, everything. Also remember this, 1 meter distancing is being observed. Our friends or our folks from NParks are making sure that everybody is safe and all social distancing measures are being adhered to. Okay, pardon me for being a bit too loud, but now I'm inside the consultation room, folks. As you can see, we got our vets there from AVS. Yep, they are here to help us check the animals. And these are folks who are pet owners who have already pre-registered their pets for a checkup here at Jurong Lake Gardens. We're gonna come closer, dude, and check out what this adik just brought in.
And there's no change like this,
You see?
since 4 months. Okay.
Hamster.
But this thing when he was younger, he was okay. He only started.
So this is not play one. It's serious, huh? It's proper consultation. Even though it's FOC, but it's still done properly and professionally. This is what we guarantee at AVS, a cluster of NParks. Sounds like some professional commercial. Okay.
But he seems to not be really he's still moving about and everything. Otherwise, I wouldn't really worry about giving it to him. Because yeah, I like things because it's very they don't really show me.
Okay, I couldn't talk too loudly inside there just now, folks, because of the fact that our vets are giving consultation free to our guests out there, for people who have signed up for this free service. So do remember that it's important that you guys understand that here at Jurong Lake Gardens now, what's happening is our hybrid pets day out. But despite the crowd, we are keeping to all our safe distancing measures, and we have all our safe measurements all put in place. Yes, everybody's masked up, everybody keeping their social distance, not more than 5 people in one group. So remember, if you're coming down to Jurong Lake Garden, this is all the way on to 6 p.m. live right here. Okay, but coming in here, yes, welcome to Take Me Down to the Paradise City where the grass is green and the girls are kitty plus some bunny. Okay. What's happening here? Folks, this is the area where we have our adoption drive going on and some other activities. What are they what am I talking about? And what are they and who are they? It's time for me to introduce you to our very first one here. Exclusively mongrels. I like that name. Exclusively mongrels. Jumpo. Look at this. Charlie's Angels, man. All women independent. Show yourself. Hi, ladies. Now look like some happening like deities, Hulu show like that, huh? They're not bad. I feel like praying us for number and then today can what time? So your name, man? Claudia. I've got Claudia here. Hello, so cute. And over here? Huh? 养猪？你是养猪？没有啦，你那边是狗吗？你哪里是养猪？ You said she really a pig. Oh, okay. Yang Chu, and over here? Lillian, very good. Now, who can I speak to with regards to exclusively mongrels? Can I just actually go there? I see this lady who's here, and she's got like sorceress. I just said like sorceress. This one's like some witchcraft or what? What's going on here, man? Fosterers. Oh, the fosterer. Yes, the person who fostered this cute little dog right there. Oh my god. Any information about the dog, the name, you know? Monty. Monty? Who are Monty? Then Monty's relative Carlo. Monty Carlo. So takut lah. I think better don't disturb the dog. I can see the dog. The dog is scared. Okay, folks. I'm just gonna bring you guys over to this side here. I'm gonna try to be as quiet as I can because I can see Monty's reaction here. Monty's really afraid. Yes? If you know dogs and you understand dogs, that's why I say, Adrian, you just relax. I walk. You're gonna fall over the place, bro. Dude, I love you, bro. I love you. My heart is done. Now, as you guys can see, some of these pets here are for adoption. They have been abused before by previous owners. But for some of them, they are very lucky to actually have new foster homes and new adopters who bring them home to actually look after them and give them a brand new life and a nice new environment. But as you can see here, as what I've heard and understand, this is Monty, one of our very special mongrels here. Now, this simple special Monty is with the fosterer, but as you can see, Monty's reaction towards a lot of things that's not very familiar for him. It's like, I just want to cuddle up and hold up in my corner. So guys, please remember this. As I've told you many episodes already, every pet is a living being. Every pet that you want to bring home, whether you want to adopt them or you're feeling rich just to make your kids happy, please don't do such kind of ridiculous things as buy just to entertain, and then when you think you cannot handle it anymore, you throw the pet away. And look at Monty now. This is a beautiful, gorgeous dog. It's a beautiful, gorgeous being. But yet, with so many people around, Monty is getting all scared and afraid. So if you think about it, folks,
Hi everyone, thank you for joining us here at Pets Day Out at Jurong Lake Gardens. As we are let's try to remind everybody about our safe distancing measures. Please ensure safe distancing when you are in the hall. As we are experiencing quite a crowded event today, each batch in the hall is only given 20 minutes. Alright, so you're given 20 minutes to go and visit all the AWGs. After that, we'll be clearing the hall. Okay, thank you and enjoy your time here. Thank you.
Now you believe this show is live stream? This is a live show? Here I'm talking, somebody just grabbed mic. Really? Do all Manchester United fans not deserve any respect anymore? This is nonsense. Must be a Liverpool fan out there that did this. Okay, let's move on to our next AWG. All right. Over here, I've got Noah's Ark hairs. Right, Noah's Ark hairs. Now, what is Noah's Ark hairs? Very simple. Their motto, their vision is neuter, adopt, and love. So this is what we're trying to encourage a lot of Singaporeans. Try not to buy a pet or purchase a pet just because my son, my daughter likes a cat, they like a dog. Just because at home nobody play with them, I throw them one dog. Look, pets' lives are also lives. Do not just purchase for the sake of purchasing. And at the end of it all, when you realize you cannot maintain that kind of lifestyle for your pet, and you start to put them up for adoption, throw them away, abandon them. This is what the issue is with a lot of people and pet owners in Singapore. So kindly just remember, the better option is to adopt, give abandoned animals a new chance, a new home. Understand them before you even want to have a pet in your house. Now, over here, Noah's Ark hairs, ladies and gentlemen. Oh my God, look at all the merchandise. So happening, man. Come on, this is like, hello, are we here for adoption or are we here for some kind of bazaar sale like that? Huh?
No, we're hoping to buy stuff for Christmas for a good cause.
Oh man, I love that. And who is this gorgeous young lady that I'm speaking to?
I wish I did gorgeous, but anyway.
Please, age is only a number. And you are?
I did, yeah.
Yek. Oh, can I just call you Yek?
Yes.
Easier lah. Like, hey, alamak, bro, you see lah. You stand so close after that bag all drop. Tote bag so cute. Look at this. Is this hand drawn? No, okay, I thought hand drawn. I thought maybe.
But then stop drawn by me.
That's why I thought some pet very smart. Just take one brush in the mouth, just bite, and then suddenly paint one dog out there. Cute, boy. So these merchandises are all up for grabs. Look, Christmas is coming up in a couple of weeks. We are all busy buying gifts for our loved ones, friends, children, parents, mother-in-law, father-in-law. But for those of you with pets, what on earth are you thinking? Your pet is also a part of your family. Get them some gifts. What lovely gifts do we get our pets now? Okay?
We have all these cooked stuff for them. They have a beef pie, they have a mini salmon meat pie, they have a cheeseburger.
Sure. Cheeseburger. Look at that.
Yeah, cheeseburger bun and meatballs.
Meatball. Oh my goodness. They got meatball inside here. You got dim sum or not?
I
You got
wish.
har gow. What? I
I was
tell you-
allergic to prawns, so therefore no seafood.
Hey, I'm allergic to seafood. Oh my God, we should have gotten married, man. But look at these. These are other products that they have here at Noah's Ark Cares. Why do we have a store? Why do we have products? Why do we have all these things? It's because in order to fund our campaign and all our activities for all these adoption drives and for all these pets that some other irresponsible owners have kind of abandoned, this is what we need. Okay? Don't think down here all multi-millionaire, nothing to do, cheng at home or nothing to do, just chin chai throw my money out, No, these guys are actually AWGs, animal welfare groups. Some of them are self-funded, some of them are really big. I'm going to give you this chance now to sell a bit, like throw some free advertisement out there, like
What
some
do we have?
live Facebook sales like that.
Okay, well, basically, everything we have on sale, and there's a lot more, everything we have on sale here, all the proceeds goes directly to the pig. There is no cost taken off. So anything you buy goes directly to us. We run a small shelter in Jurong Island, and one of the dogs we have up there is for adoption, Handsome.
Sorry, name again?
Handsome.
Stop calling me, oh my God.
I know. Sorry, just for the confusion. But he's a beautiful dog. But as you can see, he's not HDB approved. So that makes him less appealing to large majority of the population. But in terms of personality, you see we've trained him well and he's able to walk. So that's what our commitment to us, to anybody who adopts our dog, is that we train them so that they will be a valuable and loved member of the family.
Okay, just a quick one, okay? Besides huge dogs like Hanson, I believe you have also HDB approved ones.
Yes, we do at the shelter, but they are very few and far between. But whenever you're interested, tell people write into us to say what you're interested. Give us an idea of what your lifestyle is so we can actually find a good dog for you to adopt. We also do cats as well. We do sterilization. So sometimes we have cats available. So again, write in, tell us what you would have, what you would like to do, and we will try to see a match. And there's no pressure. Adoption has to be for life. So that's what we are working towards.
That's absolutely most beautifully said. Summarize in 1 minute what the whole purpose, what you guys are doing, and what people need to do before they decide to adopt or even have a pet in their house. So remember, anything up, just write in, special requests, you want a cat, you want a dog, you want what, you want this, you want that. Check out the website, www. Hey, follow my finger. Ethan, you funny now, you. www.noahsarkcares.com. Oh my god, poor chap. He's not even squat down for this. Bro, you can move the camera down while you must squat down also putting this. Somebody give this guy a burger, man. Come, I'll buy for you a present. Sorry, I'm just joking. Thanks so much, Greg. Thank you. That's handsome over there. Look at that. Handsome. So cute. Handsome! Not you, why you turn around for what? So rude at this NT, you. Look at that. Oh my god, it's a gorgeous dog. Look at that. Okay, but any dog, tail between the legs like that, there's a bit of a fear element in the dog. So let's not scare the dog too much, okay? Come, now let's turn around. Sorry. Can you all please be careful behind? Sorry, huh? What dog? Huh? My fan? No lah, I want aircon. This kind of weather, you give me my fan. Hi girls, bye. Take care. Study hard. I like that. My fan, so cute. Oh, Lama. This is the first thing that attracted me. The t-shirt. Manchester United. Our team finished already, man. Forget it. No point already. No point. We will support Lion City Sailors. Okay, over here. The ever famous, the ever well-known Society for the Prevention of Cruelty to Animals, Singapore. A lot of people go, hey, what's SPC? Actually, a society that prevent animals from cruelty. No, this is the cruelty to animals, SPCA for short. Now, here today at SPCA, what do we have? Look at that. Cat. And look at that. I thought down there, Carlos Santana want to play me some song or somebody else in SPCA can talk. Earlier on when I did my rounds before the show actually started. Just in recent times, just last week or a week and a half back, they found a total of 9 cats abandoned, and in very, very crappy conditions. Out of the 9 cats, 8 were kittens. And I believe here today we got one of the 9 cats, I think is the mummy of the litter. So to all the pet owners out there, I need you to understand this. Whether you have a dog, you have a cat, just remind yourself. A lot of people say, hey, cats are easy to look after. Cats can self-settle their own self. No, it is not. Please do not get it wrong. Yes, you see cats in your neighborhood. Yeah, some got hair, some wear nice clothes, mittens, walking around. But cats also need attention, they need care, they need time. Don't just get a cat and then leave the cat alone to do whatever the cat wants to do. That's not how it works. Sometimes by doing that, when your cat gets lost, then that's where our problem starts. And some people can't even handle cats. They think that, too troublesome, sangat, buang. Don't throw. You throw this way to the cats. Okay? So SPCA, they've got, as you know, shelter, and in the shelter they've got a lot of different types of animals. Whether it's dogs, it's cats, whatever. If you're looking for adoption, where else better than to look for all these AWGs of ours? Righty? Under here, for carrying nature of your animals, also products. As you all know, SPCA is also self-funded. So if you got some time, you want to purchase some items, go. SPCA, just like Noah's Ark Cares and also Exclusive Mongrels. Show your support to all these guys. Coming up next. This is my favorite one. It's like some Earth, Wind and Fire song. Bunny Wonderland. Oh yeah, come on. Hey. Hello, 小白糖. White bunny candy. So, Bunny Wonderland, come on. Hi, your name, please?
My name is Lynn. I'm from Bunny Wonderland.
Oh, Lynn from Bunny Wonderland. Okay, Lynn, you want to tell our audience more about what Bunny Wonderland is all about? Come here.
So I rescued Singapore. think Fortunately, we do take in about 100 rabbits every year.
How many?
100. It's because that's our capacity because we are private rescue.
Private rescue.
Yeah.
Wow.
All
So,
of-
so that means, okay, you're doing this all on your own account, your own, as in really account, your account now, plus
Yeah, my
bank
pocket,
account.
my pocket.
Yes, okay, cantik. That's what I like to hear. So, 100 rabbits. Now, where do you normally find them? Okay, wait, 2 minutes. Now you believe this is a live show. I'm burning this guy's hair. Whoever the first making announcement holding my eye, burn his hair. I tell you. Okay, back to you, Lynn. So,
Yeah.
where do you find them normally?
About half of them are actually surrendered by people. Maybe they bought it from a pet shop, they realized it's too much work, and then they give it up to our rescue.
Is looking after a rabbit very difficult? You said a lot of work, huh?
It's not difficult, but your expectation has to be right because they do live a long time. They live 8 to 10 years, and they do require vet care. And not every vet in Singapore can take care of rabbits.
Wow,
Yeah.
you like that say, yeah?
Yeah.
Sister, this show is proudly brought to you by AVS. Huh? Animal and Veterinary Service is a cluster of NParks. You like that say, yeah? This could be your last outing with us already. I tell you first. No, just joking. Okay. True, what she says is true. Not all vets can handle, but here at AVS, most of our vets can handle all animals. Except me. Okay.
You're not vet.
No, I'm not animal. She didn't get it. Oh my gosh. I have to explain myself. Okay, come. I just want to ask you this question. This one already got me. If there's any way you can zoom in on the background of Billy. Billie. Billy was given up. Okay, take a time, bro. Lama, what thing? This whoever your boss is, you got to be paid more for this. Look at the story, guys. If you're listening to me, you can hear this. Billy was given up by her 4th owner. Can you imagine this? 4th owner gives you up. I want you to picture this, guys. I want you to imagine this, okay? All of you imagine this. If you were Billy, all right, you had a first home. Somebody gave you up. You had nowhere else to go. Somebody else came along, picked you up, and then gave you nice vegetables, stuff like that. After a few months, throw you away. Third time, somebody picks you up again, gives you a home. After that, same thing. Alah, buat bodoh. Buang. 4th owner comes, same thing, thrown away. How would you feel? What would your emotions be? So, I'm beseeching, I'm begging, in fact, all you pet owners out there. Some of us think that, ului, orang kaya, got money, buy, my daughter, my son like, I buy, give them, go, ha. Don't do that. If you're not able to keep up with the lifestyle of your pet, you're not able to help your pet grow, you're not able to give your pet what it truly deserves, don't do that. If you are truly looking for a pet to give a life to, adopt. That is the best way to go because you won't know what these animals are going through. They have been abandoned 4 times. If it were you, wouldn't you have already abandoned up on a lot of other things? So Lynn, story about Billy, 4th owner. How old is Billy?
She was 5 years old when we took her over from the 4th owner.
5 years old?
Yeah.
Okay, so what was the condition that they didn't want?
She was not sterilized, so her behavior was a little bit more extreme.
Cranky.
Yeah, she was very angsty, just like a woman on PMS, right?
Okay, this is not a sexist program. do not get it wrong. That statement was from a woman. Okay.
Yeah,
Okay. Then the 2 men better get up, stop kneeling down because they talk about PMS are getting them worried. Okay.
Yeah, rabbits that is not sterilized because they do come with some behavioral issues, and so if they don't know how to take care, obviously they give up lah because she got naughty lah.
Okay.
They
Then-
wanted an easy pet lah.
Easy pet, but it ended up very difficult.
Yeah.
And one more thing I noticed down here, this is very cute. Adrian, you don't worry about it, Adrian. I want you to focus on that white rabbit over there. Okay, bro, you're focusing on the wrong white one. The rabbit, not that white rabbit. You nonsense, this boy. Ayyo, terrible creature, horrible monster. Oh, look at it. Oh, this guy is professional, man. Look at that. They never heard of this function called Zoom on the phone. Okay, never mind. Let's not go there. Okay, this one here. Tell us a story about this lovely bunny here. Heather?
Yeah, so Heather is also about 5 years old. She was rescued from a preschool. So the
Preschool?
yeah, the preschool used to have bunnies, and they keep them for the children to play with. But eventually they realized they don't want to keep the rabbits around. And when we took over Heather, she was also not sterilized. In fact, she was found with a stillborn inside her. So she was mixed with other boys in the past, like other boy rabbits.
What the hell?
Yeah, and they didn't know, and she couldn't tell them either. So when we took her over, we did a sterilization on her, and we found out about the baby in her.
Oh my god, this is really sometimes just so sad to hear, man. It's really sad to know and to hear. So folks, I think the message here is what Lynn and I are trying to tell you guys is, please, don't just take these pets as just masak toy, can go and recycle. Or it doesn't work this way. We've been saying so many episodes, so many times. Please give a good thought before you have a pet in your house. Now, Lynn, I need you to do some koyo selling, yeah, some hardcore sales thing. I see some products over there from Bunny Wonderland Singapore. Come, you can join us. Come. Don't be shy. The last 1 minute already.
Okay.
So this is roughly what you need to spend on to have a bunny in the house.
Alright.
Wow, then the Playboy mansion should be very rich, right? I'm just joking. Okay. That one censored. Yeah, my life was being interrupted by somebody. I don't know who was it. Okay, so it's time. Cleaning, 60 minutes.
Hi everybody, gentle reminder that the room here will be given another 5 minutes. In about 5 minutes time will be given the room for the next batch of visitors.
What a marah, huh? What a mati. Okay, alright, come, let's go. Bunny.
Yeah, I mean, it's not exactly, that amount of time, but it's to show you that it does require quite a bit of time to take care of them. And especially for rabbits, we find that people tend to put them in cages. In fact, what we're trying to show you today is also they need a lot more space, they need a lot more interaction. And of
Cannot give them iPhone and play, man. Like my children, just throw iPhone and then they are bad. iPhone. But they cannot play.
Yeah, they can't play. So we do have houses and toys for them. So these are investments you have to put in now if you really want to do them.
$500 a month.
Yeah, it's not cheap. Okay, not exactly a month. I think it's for occasion.
For occasion. Okay, this one lah. Don't scare me lah. Per month $200 mampus. Like that, no wonder nobody want rabbit. So this on the special occasion when got problem, then got. In 5 years no problem, God bless you. In 6 years no problem, bagi best. 7 years no problem, all the way no problem until the last day of existence. Good for you. Come, Lynn. As you have mentioned, you guys are pretty much also self-funded, right? So it's a charity organization, and a lot of staff are actually from the volunteers and from your own pockets who come out and you look after all these rabbits before they are put up for adoption. So explain to me what you have here for your drive.
Yeah.
So
we are very we are honored to receive what Sonia? Okay, to receive support also from local suppliers. So this one was sponsored to us by Yeti. They are the distributor of Oxbow. Oxbow is a really good product for rabbits, as well as small pocket pets like guinea pigs and mouse and hamsters. So they donated these items to us for sale to raise funds because they know we're privately rescued. We were private rescue, and some of these items are also handmade by some of our volunteers. So the volunteers will also make items to donate. And similarly, these are the animal and children-friendly rugs that we also sell to raise funds for the animals. Thank you for promoting.
Thank you so much, Lynn. Thank you. So remember, we're having this hybrid Pets Day out live right here at Jurong Lake Gardens all the way to 6 p.m. But for our live stream here, we want to thank our two special guest vets who are with us. They are basically Dr. Suria and Dr. Heng. Thank you to them for the insightful sharings. Lynn from Bunny Wonderland. Love that name. Sounds like a music. Yeah, a song. SPCA. Not forgetting also, we've got, you remember? Nova's Art Cares. Very good. Intern, pay attention. Huh? And then the first one, Mongrel. No lah. Exclusively Mongrel, bro. Not just Mongrel. Ayyo, this fella. So remember, guys, some of them have websites. Some of them actually have got a virtual platform or an online platform for you to make purchases. These mats are not just for bunnies. They are bunny printed mats. You can put anything, anybody on the mats. Okay? So go ahead, show your support and some love. If you are not bunny owners, doesn't matter. You can help them. Remember, adoption is key. Come down. If you find some lovely pets that suit your family, give them a home. That's what we're talking about. So to the next episode of Pets Day Out, my name is Justin Missensing. Thank you guys, and on behalf of the folks here at ABS and also NPOPs and all AWGs, we wish you, your family, your loved ones, and your pets a very blessed, Merry Christmas and a Happy New Year. Peace out. Okay. Agora.